What are residency interviews like? Today I'm going to share with you what a typical residency interview day was like for me. If you're new here, my name's Alyssa. I'm a fourth-year medical student, soon to be anesthesia resident, and this year I interviewed in anesthesia, and I also interviewed with transitional year residency programs, internal medicine, and surgery prelim programs, because not all anesthesia residencies are categorical. Some are advanced, so you have to go somewhere else for your first year. So I did all those sorts of interviews. And of course, what I talk about today is pretty specific to those areas. I can't speak on what a dermatology interview would be like or an ophthalmology interview. This is more specific to my experience, but I hope it can be helpful to you. And maybe there are some general things that you can take away. Getting started, usually a week before, maybe a few days before, you'll get your schedule for the interview day. Most of the time, mine had some sort of informational session at the beginning. Usually the PD would talk and they tell you more about the program. After that, you would typically start your interviews. Usually I would interview with 3 to 4 people, and those interviews were about 15 to 20 minutes each. Typically, it was with the program director, a couple of faculty members, and then a resident. The interviews were slightly different depending on who you were with. And then when you weren't interviewing, usually you could be in a breakout room with residents and speak with them and ask them questions, or else you could turn off your camera and take a break. And then when you're all done for the day, they would just dismiss you and let you go. And sometimes they would have a conclusion statement at the end of the day, and that was it. Most of my interviews, they were trying to get to know me, get to know more about the application. Sometimes they would ask weird questions, but for the majority, they're trying to get to know you. They weren't asking you, like, what drug would you use in this context, or what would be the best next step? Like, they're not asking you board questions. That might be different in different fields that you're going into, but for anesthesia and these intern years, they're mostly just trying to get to know you. I did have one transitional year interview where they were asking me, like, a patient has a massive PE, the nurse is refusing to give them heparin, blah, 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 what would you do? That was a little bit of a stressful scenario. But yeah, for the majority of the time, they're just trying to get to know you, so it should be somewhat of a comfortable experience, and they know you're nervous, so it's not so bad. That was my experience with interviews. I hope this can be helpful for you. If you have any questions, please leave them below. I'll try to get to them, and like and subscribe for more.